Okay, my name is Allie Johnson. I'm doing my hip palpation video. It is October 15th of 2020. The iliopsoas has two muscles, the psoas major and the iliacus. The psoas major originates on all lumbar vertebrae, transverse processes. It inserts on the lesser trochanter of the femur, which does hip flexion. The iliacus originates on the iliac fossa. It inserts on the lesser trochanter of the femur and does hip flexion. The sartorius muscle originates on the anterior superior iliac spine of the ilium and inserts on the pes anserine of the tibia. Its movements are hip flexion, abduction, and external rotation. The rectus femoris originates on the anterior inferior iliac spine of the ilium and inserts on the tibial tuberosity. Its movements are hip flexion. The tensor fascial lata originates on the outer lip of the iliac crest and inserts on the greater trochanter of the femur and iliotibioband to Gerdy's tubercle of the tibia. Its movements are hip flexion, abduction, and internal rotation. The pectineus originates on the pubic bone and inserts on the pectineal line of the femur, and that does hip adduction. The biceps femoris has two origins: the long head, which is on the ischial tuberosity, and the short head, which is on the linea aspera of the femur. It inserts on the head of the fibula and the lateral tibial condyle, and that does hip extension. The semitendinosus originates on the ischial tuberosity. It inserts on the pes anserine of the tibia and does hip extension. The semimembranosus originates on the ischial tuberosity, inserts on the medial tibial condyle, and does hip extension. The gluteus maximus originates on the sacrum, coccyx, and posterior gluteal lines of the ilium and the iliac crest, and it inserts on the gluteal line of the femur and the iliotibioband, and its movements are hip extension and external rotation. The piriformis originates on the sacrum and inserts on the greater trochanter of the femur and does hip external rotation. The adductor longus originates on the pubic bone, inserts on the middle 1/3 line of the linea aspera, and does hip adduction. The adductor brevis originates on the pubic bone, inserts on the proximal 1/3 line of the linea aspera, and does hip adduction. The adductor magnus originates on the pubic bone and the ischial tuberosity and inserts on the distal 1/3 line of the linea aspera and the adductor tubercle, and that does hip adduction. The gracilis originates on the pubic bone, inserts on the pes anserine, and does hip adduction. The gluteus medius originates on between the iliac crest and anterior posterior gluteal lines of the ilium. It inserts on the greater trochanter, and its movements are hip adduction and internal rotation. The gluteus minimus originates on the anterior inferior gluteal lines of the ilium and inserts on the greater trochanter, and its movements are hip adduction. The bursa of the hip, the trochanteric bursa, is just on top of the greater trochanter. The iliopsoas bursa, anterior and inferior of the iliac spine. Here, the ischio-gluteal bursa is just located on the ischial tuberosity, and the sciatic nerve is just on the greater trochanter and ischial tuberosity. Can be palpated on the hamstrings for pain, and that does hip flexion. Then the ilium, we can palpate the anterior superior iliac spine. If you put put your hands on your hips, and it's just that anterior sharp notch that you feel. The inferior iliac spine is just inferior to the anterior superior iliac spine. The iliac crest, you just follow that line forwards with your thumbs. The posterior superior iliac spine is your back dimples between the buttocks and the waist, right here. And then we have the ischium, which lies on the ischial tuberosity. So your hand is under the glute, and it moves towards the midline of the body, and you'll feel that. The pubic bone, I'm just going to point to it, is just anterior to the pelvic girdle, and the femur is just this thigh bone, and it's got a greater trochanter, so you start on the side of the iliac crest, move your thumb down. If you put your patient in external rotation, you'll feel that greater trochanter. So for the lesser trochanter, you just go posterior to that on the medial side, posterior medial. Just lower than the buttocks, and you'll feel that lesser trochanter. The intertrochanteric line is anterior on the femur, and the intertrochanteric crest or ridge is posterior on the femur. The linea aspera is posterior. It's a long lip on the thigh of the superior and inferior ends. And there's the coxofemoral joint, which starts on it's a ball and socket joint from the femoral head to the acetabulum, and has 3 degrees of freedom. And the sacroiliac joint starts in the posterior superior iliac spine of the ilium. Find that shelf, and it links the pelvic and the lower spine together. Lastly, we have a gluteal line, which is just near the lesser trochanter, which is posterior. And that's my hip palpations.